Hello everyone, myself Akanksha Sinai-Burkar, first year student of Gomantak Ayurved Mahavidyalaya and Research Center. Today we will be talking about PCOS. So, what is PCOS? PCOS stands for Polycystic Ovarian Syndrome, a hormonal disorder common in women of reproductive age, characterized by irregular periods, excess androgens, which are male hormones, and enlarged ovaries with small cysts. PCOS is a health problem that can affect women's menstrual cycles, ability to have children, metabolism, hormones, heart, blood vessel, and appearance. So now we will be talking about prevalence of PCOS. The prevalence of polycystic ovarian syndrome in India is estimated to range from 3.7% to 22.5%. This makes PCOS a significant health concern for women in India. Some studies have reported higher prevalence rates, with one suggesting that 20% of Indian women may suffer from PCOS. There are various factors that contribute to PCOS. Starting with genetics. Genetic predisposition can play a role in the development of PCOS. PCOS can run in families, suggesting a genetic component. Certain genes related to androgen, metabolism, and insulin sensitivity may be involved in this. The next factor is lifestyle. Obesity and unhealthy eating habits can worsen PCOS symptoms and may increase the risk of developing the condition. Sedentary lifestyles, lack of physical activity, stress, and sleep deprivation can also play a role. Finally, disruptions in the neuroendocrine systems can also contribute to the condition. So, we will see difference between PCOS and PCOD in this slide. PCOS is rare and is seen in less patients, and PCOD is very common in women worldwide. PCOS is an endocrine disorder of ovaries with immature follicles, and PCOD is metabolic disorder due to hormonal imbalance. In PCOS condition, women have minimum number of cysts in ovary, whereas in PCOD, women have more than 10 cysts in each ovary. Genetics, poor lifestyle, eating habits, and mental health are causes of PCOS. And genetics, insulin resistance, inflammation, and weight fluctuations is cause of PCOD. Some complications of PCOS are: first, it is hard to get pregnant. There is risk of diabetes, risk of high blood pressure, obesity, and endometrial cancer. In PCOD, it is easy to get pregnant with medical aids. Some symptoms of PCOS are: first, irregular menstruation. Cycles can get delayed or the person can get amenorrhea because of PCOS. Second is weight fluctuations. Third is hair thinning. Lots of hair fall issues are seen in the person with PCOS. Fourth is early development of secondary sexual characteristics. If a person gets PCOS during menarche, early developments of breasts, pubic, and underarm hairs is seen. Some patients may experience itchiness in vagina and tenderness in breasts due to hormonal fluctuations. In some patients, hirsutism, that means growth of facial hair, is seen. Patients also get acne, mood disorders, and insulin resistance because of PCOS. These are some main symptoms of PCOS, but they can vary in each individual. Now, let's discuss PCOS through some cases, where I have mainly focused on the symptoms which are experienced by different patients. This patient is 32 years old from Goa, diagnosed with PCOS at age of 28. Her periods stretched to once every 60 days. So she consulted a gynecologist. After ultrasound and blood tests, PCOS was confirmed. She experienced symptoms like oily skin, 9 kg weight gain, itchiness in vagina, lumpy and tender breasts, acne breakouts, pigmentation, and hair loss. This second case is of 20 years old from Goa. She got her first cycle at 15, but then her cycle stopped for 1.5 years. Therefore, she consulted a doctor and was diagnosed with PCOS. She had multiple symptoms like acne breakouts, hair loss, menstrual amenorrhea, rapid weight gain from 34 kgs in 4th standard to 102 kgs in 9th standard, sleep issues, anxiety, panic attack, and hypopigmentation. Finally, this third case is of 19 years old who was diagnosed with PCOS at the age of 17. She experienced symptoms like irregular menstrual cycles with gap of 2 to 3 months in between, and then slowly the gap increased to 3 to 4 months, oily skin and acne, increased growth of body hair, frequent hair loss, and gradual increase in body weight. PCOS affects everyone differently, from irregular periods and weight changes to emotional and physical challenges. But it can be managed with right diagnosis, treatment, and lifestyle support. Moving on to the causes. PCOS is often associated with elevated levels of male hormones, androgens, and insulin resistance. This can disrupt the normal function of the ovaries, leading to irregular ovulation and menstrual cycles. Insulin resistance is another cause. Here, the body's cells don't respond normally to insulin. This can lead to increased level of insulin, which can further contribute to androgen production. Research has also shown that certain genes may be linked to an increased risk of developing PCOS. If you have a family history of PCOS, you may be more likely to develop it yourself. Low-grade inflammation is also a cause that has been linked to the development of PCOS, potentially contributing to increased androgen production and insulin resistance. Moreover, some research suggests that exposure to air pollutants and pesticides may be associated with an increased risk of PCOS. Finally, being overweight or obese can worsen insulin resistance and other PCOS symptoms as well as contribute to hormonal imbalances. Preventions of PCOS are as follows. First is healthy diet. Prioritize whole, unprocessed food like vegetables, fruits, lean proteins, and low glycemic carbohydrates. Second is regular exercise. Aim for at least 30 minutes of moderate intensity activities most days of the week. Third is weight management. Maintaining a healthy weight or losing even a small percentage of body weight can improve hormonal balance and reduce insulin resistance. Fourth is stress management. Practice stress reducing techniques like meditation, yoga, or spending time in nature. Fifth is sufficient sleep. Aim for at least 7 to 8 hours of sleep per night to help regulate hormones. Sixth is regular checkups. Routine medical checkups can help identify and manage potential PCOS symptoms early on. To conclude, we have talked about various aspects of PCOS that women around the world deal with. I hope that this video was informative. Thank you.